Shoulder pain is not random. The location of where you have pain and the symptoms you experience can serve as diagnostic clues to the underlying problem. And by understanding the source of your symptoms, you can then take the appropriate steps to treating your pain. Hey everyone, Dr. Jeff Peng here. I'm a sports medicine physician currently practicing in the San Francisco Bay Area, and in treating thousands of patients with shoulder pain, I see the same patterns come up again and again. Certain types of pain are far more common than others, and when you match the location with the way the pain behaves, you can narrow down the likely diagnosis. So in this video, I'm going to walk you through the most common causes of shoulder pain by location, explain what they mean, and help you understand what to do next. Let's start with the most common cause of shoulder pain, and that's rotator cuff disorders. Rotator cuff problems tend to cause shoulder pain that is felt along the outside of the upper arm, often in the deltoid region. Patients usually describe the pain as a dull ache that worsens with overhead activity, reaching behind the back, or lifting objects away from the body. One of the hallmark features is pain at night, especially when lying on the affected shoulder, which can significantly disrupt sleep. Rotator cuff issues range from irritation and inflammation of the tendons, often called tendinopathy, to partial or complete tears. These conditions are incredibly common. Studies show that up to 20 to 30% of adults over the age of 60 have a rotator cuff tear, even if not all are symptomatic. The pain arises because the tendons get pinched or overloaded, leading to microdamage and inflammation. Over time, if the tendon fails to heal properly, the structural integrity can weaken, progressing from tendinopathy to partial and then full thickness tears. The next major cause of shoulder pain is adhesive capsulitis, or what's more commonly called frozen shoulder. Unlike rotator cuff problems, where the pain is usually worse with specific activities, frozen shoulder is characterized by both pain and a progressive loss of motion. Patients often describe a deep aching pain throughout the shoulder joint, but what really sets it apart is the stiffness. Everyday tasks like reaching overhead, fastening a bra strap, or putting on a jacket becomes nearly impossible. One of the key differences between frozen shoulder and rotator cuff problems is the pattern of restricted motion. In frozen shoulder, the loss of range of motion is global, meaning all directions of movement are limited, both when you move the arm yourself and when someone tries to move the arm for you. In contrast, rotator cuff disorders can also cause weakness or limited motion, but usually only in one or maybe two directions, such as abduction or external rotation, but all the other ranges of motion of the shoulder remain relatively normal. Another common cause of shoulder pain is osteoarthritis. And while the shoulder doesn't develop arthritis as frequently as the knee or the hip, it's still an important source of pain, particularly in older adults. There are two main types: glenohumeral joint arthritis, which affects the ball and socket joint, and acromioclavicular joint arthritis, which is the AC joint, and this affects the small joint at the top of the shoulder. Glenohumeral arthritis typically causes a deep aching pain felt throughout the entire joint. Patients often describe stiffness and grinding or catching with movement. Unlike frozen shoulder, the loss of motion isn't truly global. It's more of a gradual, painful restriction that gets worse as the cartilage wears down. Pain is often aggravated by weight bearing through the arm or repetitive motion like lifting overhead. AC joint arthritis produces pain that's localized right on top of the shoulder. A classic symptom is discomfort with cross-body movements like reaching across to grab a seatbelt, or some people have pain while doing a push-up. Many patients will even point directly to the joint at the end of the clavicle when asked where it hurts. AC joint arthritis often coexists with rotator cuff disorders, and that can make this diagnosis a little bit tricky. Another important cause of shoulder pain, especially in younger and more active individuals, is labral injury and instability. The labrum is a ring of cartilage that deepens the shoulder socket and helps keep the ball of the humerus in place. When it's torn, or when the ligaments around the joint are stretched or damaged, the shoulder can lose stability. Patients with labral tears or instability often describe pain that feels deep inside the shoulder rather than on the surface. They may notice clicking, catching, or a sensation of the shoulder slipping out of place. In athletes, especially throwers or swimmers, this can show up as pain with overhead motions or loss of throwing velocity. In others, it may present after after a traumatic event such as a fall or a dislocation. And unlike rotator cuff or arthritis pain, which are more predictable and constant, labral and instability problems can be intermittent and position dependent. A classic example is pain or apprehension when the arm is placed in an overhead and externally rotated position, like the motion of throwing a ball. Another possible source of shoulder pain is biceps tendinitis. This typically presents as pain in the front of the shoulder, especially when lifting, pulling, or carrying objects. Patients often point directly to the groove at the top of the humerus where the tendon of the long head of the biceps runs. In most cases, the biceps pain is not the primary problem, but it occurs in association with other shoulder disorders, especially rotator cuff disease or labral tears. When the rotator cuff, particularly the subscapularis or supraspinatus, is weakened or injured, the long head of the biceps takes on an added role in helping stabilize the shoulder. And so this extra mechanical load can irritate the tendon and produce that sharp or aching pain in the front of the shoulder. Because of this close relationship, treatment isn't usually about targeting the biceps tendon alone. The real solution is addressing the underlying shoulder pathology. Once the rotator cuff or labral issue is treated, the stress on the biceps tendon decreases and the pain often improves significantly. Another condition that can mimic shoulder problems is cervical radiculopathy, which is pain referred from the neck. In this case, the pain isn't coming from the shoulder joint or the tendons at all. It's actually caused by a pinched or irritated nerve root in the cervical spine. Cervical radiculopathy often produces pain that radiates from the neck into the shoulder and down the arm. Patients may also notice numbness, tingling, or weakness in specific patterns depending on which nerve root is affected. Unlike rotator cuff or arthritis pain, which is usually localized to the shoulder itself, radicular pain often travels in a line or a band and may worsen with neck movements, such as looking up, turning the head, or holding the head in one position for too long. This distinction is critical because treatment for cervical radiculopathy is very different from treatment for shoulder pathology. Managing the neck problem, whether through physical therapy, posture correction, medications, or targeted injections, that's what's going to help improve the symptoms. That's why anyone with radiating pain, numbness, or weakness should be evaluated carefully to make sure the problem isn't coming from the cervical spine. Okay, another important cause of shoulder pain is acute calcific tendinitis, and this occurs when calcium deposits form within the rotator cuff tendons, most commonly the supraspinatus. And while calcium deposits can sometimes sit silently in the tendon without causing symptoms, the process of calcium formation can trigger a sudden and extremely painful inflammatory reaction. Patients with acute calcific tendinitis typically describe 10 out of 10 pain that comes out of nowhere without any trauma, without any injury. The pain is so intense that many of them end up in the emergency room for relief. Unlike the more gradual onset of rotator cuff tendinopathy or arthritis, this pain strikes abruptly. It's incredibly inflammatory, and it often makes it nearly impossible to move the shoulder. Even small attempts at lifting or rotating the arm can send sharp stabbing pain through the joint. The good news is that this acute formative phase is usually self-limited. The severe pain tends to last several days to a couple of weeks, after which the inflammation subsides. Treatment in this phase is aimed at controlling the pain with anti-inflammatory medications, rest, sometimes injections, until the episode resolves. And while it can feel catastrophic in the moment, the prognosis is generally favorable and surgery is rarely needed. Another source of shoulder pain that's often overlooked is myofascial trigger points. Unlike structural problems inside the joint, this pain comes from irritated or overworked muscles around the shoulder blade and upper back, most commonly in the rhomboids, the trapezius, the levator scapula, and the rotator cuff. Patients with myofascial pain usually describe a dull aching or sometimes a burning discomfort along the scapula, the upper back, rather than deep in the shoulder joint itself. The pain can be quite focal, often felt in tight knots or bands of muscle that are tender to touch. Posture plays a key role here. Hours in front of the desk, looking down at a phone, or repetitive overhead activity can overload these muscles and lead to trigger points that refer pain towards the shoulder. One of the key clinical clues is that shoulder strength and range of motion are usually normal, and this helps separate myofascial pain from rotator cuff problems or arthritis. Treatment focuses on addressing the muscle dysfunction, stretching, strengthening postural stabilizers, soft tissue release, and improving ergonomics. Once these muscles are retrained and the overload is reduced, the pain typically improves quickly. Okay, so now that you know the most common causes of shoulder pain, the next step is learning how to actually fix the most frequent culprit, which is rotator cuff disorders. Most people don't realize that the right exercise can both reduce pain and restore function without relying on injections or surgery. So check out this next video where I walk you through the exact evidence-based exercises that I give my own patients to treat rotator cuff problems and strengthen their shoulders for good.